Hi, and this is In the Public Interest. My name is Linda Johnson, and our guest tonight is Dr. Charles B. Simone. And we spent the first half of the program talking a little bit about health care reform, and that should be on everyone's mind because it affects us all ultimately. And we talked a little bit about the Kids Start program. But this is September. And one of the things that I wanted to make sure we touched on was the H1N1 virus, and I will say in parentheses, swine flu, that we're coming up on flu season. So I wanted to get your input, Dr. Simone, a little bit about H1N1.
Well, understand this, and people may not understand it, that 40 to 50,000 people a year in this country die of the flu. Whether it's the swine flu, the H1N1, all these other things. But that's how many people die generally every year in our country. So it's not a big surprise that people die from the flu. And about 100 years ago, hundreds of thousands, millions of people in this country died. So we have to be aware of that. Now, is this flu any different? Well, in some people it can change, and some people are weaker than others, the immune system. So we have to be aware of who is. But there are a number of things we have to do to help prevent this from happening. And you can't rely on a flu shot, a vaccine, that one, has not been approved yet by the FDA, and two, really hasn't been exposed to the peer-reviewed literature as much. So we need to look at the data before we can say, I'm going to jump on that bandwagon and get vaccinated.
So although we all know and we've heard about H1N1, we should still, especially older Americans and people who may have other comorbid diseases, should get normal flu, just regular flu shots.
The older person may be a lot better positioned than the young person in our country for the H1N1 flu, because they probably were exposed to it during their lifetime. If they're over 60 years old, they probably were exposed to it during their lifetime. So the people at risk are pregnant people, little tiny children, babies, infants, that kind of thing. And there's a whole list that people go on the talk show circuit and spout out for you. The point is, what we need to do is take hygiene very seriously. We need to wash our hands thoroughly, often, but importantly, and we neglect this, we need to wash our face, because our hands go right to our face. So you can wash your hands after you touch your face, but if the virus is still up on your face, that's where it needs to be to get infect you. So we need to wash our hands and our face, our nose, our mouth area, etc., nostrils. That's important, and we need to do it often. We need to be smart about it. If we're in church and you're supposed to shake people's hands and they're obviously coughing and spitting, you just got to stop. Don't shake their hand. If you're in large groups, or if you have a child that you need to go to work, but the child's infected with some kind of syndrome, you can't send the child to daycare center because you infect so many other kids. We just have to be smart about it and judicious with hygiene and common sense.
I know I ride public transportation, and my biggest gripe about anyone is if you are sick, please stay home.
And cover
the cough into a handkerchief or a napkin or a tissue of some sort.
That's right.
And I always keep Purell or something in my wallet, even
alcohol.
if I blow, some kind of alcohol prep or something to just rub. But
understand the handles of the trains and the doors are all infected. And also understand that after 12 hours, a virus will die on an inanimate object, so you don't have to go crazy in a schoolroom situation overnight.
I wanted to bring that out because a lot of people will say, ooh, but viruses are while they are viruses, are a bit weak, and they can't last that long.
No, so, if there's gum or candy on a desk, then there's going to live longer, but otherwise not. So that's point one, good hygiene. Point two, there's a number of other things. There are large studies involving zinc in children and bacterial pneumonia and viral pneumonia, and how zinc once a week, 50 to 70 milligrams once a week to all ages, will decrease the death rate from bacterial and viral infections, and also the the harm, the morbidity associated with these illnesses. So it's not a bad idea. It's pennies, costs pennies a day to do it. Once a week, you take a zinc tablet, and you'll help yourself. You can gargle with peroxide. You know, if you are in contact or other people around you may have had it, just put hydrogen peroxide right out of the bottle into your mouth, leave it there, swish it around, then spit it out. You do it a couple times a day during the height of the season. That changes the virus, and it also kills the virus on contact. And it doesn't hurt you at all. It also kills all the bacteria and the plaque that you have, and you have healthier gums from it.
Cool.
And that's cheap. Hydrogen peroxide is real cheap.
Yeah, so we don't really have to spend a lot of money, and a lot of it has to do with just good common sense.
Common sense, know about peroxide, know about soap and water, know about zinc, a couple other things. We know vitamin C helps, but we need to take a couple thousand milligrams a day during the height of the flu season to help us. It's better to take a tablet as opposed to try to get it from orange juice or something like that, because then you know for sure you're getting 1,000 milligrams. These simple measures can be easily implemented in a community, in a statewide government, and statewide governments or townships or city governments should really look at this as a means of implementing it for their people to decrease the risk. And that's what we're talking about, decreasing the risk, not eliminating the risk, but decreasing the risk of a viral pandemic.
So it's like prevention.
That's all. That's the name of the game in everything.
In everything. And you know, I had gone to the CDC website, and one of the things I noticed was, and there are symptoms. You kind of know when you have the flu.
That's right.
You have a fever. You have a sore throat. You've got itchy, scratchy. You're aching.
Well.
And you know, I say all the time, please stay home.
The truth is, you can read that list of symptoms and know it's a cold versus a flu, but when a person has it and their emotions are high, they're going to say they have the flu and they'll panic, and that's what we don't want. We don't want panic.
Right.
But if we can empower somebody with simple hygiene, simple maneuvers that they can take care of themselves with and their families, then there's no need for panic,
especially
no need for
hand
emotion.
washing.
That's right.
Oh, and I watched this weekend while I was in, and that was something that they just hammered.
Right.
Just constantly wash your hands. Wash your hands. Wash your. I mean, it's good anyway, but especially coming up on the flu season.
So in our Kids Start program, we'll talk about this everywhere we go. Wherever we speak about the breast cancer patients or prostate cancer patients, we'll add this to our talk because it's easy, it costs pennies, and it's very simplistic.
Now, I know we are getting ready to hit into the flu season.
Yes.
And we talked a little bit about the Kids Start program, but I always like to touch on cancer and nutrition. And we did hit on the 10-point plan a little bit with the kids and Kids Start, but I think it would be beneficial for us to maybe just run through them real quickly.
Well, a good prevention program for cancer, heart disease, or even flu-like syndromes are the same. We know that fatty food will suppress the immune system. So during a flu-like season, if you want to prevent cancer, or if you have a cancer and decreasing the risk of cancer, you avoid the four-legged animals, the shellfish, the dairy, unless it's non-fat or skin. You can eat two-legged animals. You can eat fish that swim from the ocean, not the farm. And you should take, and anything that grows from the earth is fine. You need to take vitamins and minerals, because our food supply today is not what it used to be. So compared to 1975, we're about 14% to 400% less vitamins and minerals in the foods than 1975. So you need vitamins and minerals. Secondly, smoking, we know, suppresses the immune system. Alcohol suppresses the immune system. An inactive person has a suppressed immune system. So we need to get out there and walk 20 minutes, 3-4 times a week. And mental relaxation, something to do on purpose to relax your brain, is very helpful as well. Things like music, hot shower, even spirituality. These are all calming effects on the brain and thereby will enhance the immune system. And we teach this to children in our Simone Kids Start program. We teach it to cancer patients, heart disease patients, because all these factors do two things. Enhance your own immune system. At the same time, suppress things that make tumors grow, make heart disease worse, diabetes worse, and kids get ill.
That's very good. I mean, I know we've talked about the Simone 10-point plan before, and I know we're going to be, I believe it's on September 18th down at Trinity Cathedral, where we're going to actually be speaking to some child care providers about the Simone Kids Start program.
Right.
Now, is there anything you can leave us with that, I think you kind of touched on everything. I think we're coming up on flu season, and we talked about H1N1, but I think everybody should get a flu shot. For example, I always say I've reached that age when my doctor will say to me, well, Linda, you know, you should have a flu shot. Yeah.
Well, I think there's some people who are more at risk than other people, so that's important to know who those people are. People with chronic illnesses who are immunosuppressed, I think there may be some role for the flu shot with those people. But with regard to the H1N1, we really need to look at the data before we say en masse everybody get the shot, or the people at risk should get the shot. I don't think we're there yet. We don't have that data to say, yes, scientifically, that's what we have to do.
Now, I got a question from someone, just real quick. How healthy is it to be outside in the sunshine? Or if we're in our homes to, like, open those drapes and let the sun in,
it's very important.
Fresh air.
We need fresh air. Most of our buildings are cooped up. We have windows and air conditioning and heating systems. We need fresh air in our homes. We also need to be exposed to the sunlight. We shouldn't avoid it. Now, we've gone to the nth degree with sunscreens and sunglasses and hats and long sleeves. We've gone overboard, perhaps. We do need to have some. People who are up here in the Northeast, as opposed to down near the equator, have a higher risk of cancer, maybe because of vitamin D3 is lower in their system than those who live in the equator area, or that moderate temperate zone.
But I think it's also important to kind of, it's as my grandmother used to say, kind of air that house out.
Well, we need to do that.
You know how we got to let it come through?
And we need to get our children out in the street, too, and play and get dirty and really have a good time.
Yeah, and that's what it's about. And it will also help the, obesity problem.
You're right.
Okay.
You're right.
Well, thank you, Dr. Charles B. Simone, for being my guest this evening. I'm sure we only meant to touch on just a few things we want you to think about. If you get a chance to go to a website or listen to the President's message, voice your opinion, H1N1, just be smart, be healthy.
Common sense.
Common sense. And keep those hands washed.
And there's a lot of things you can do to help yourself. That's the key thing.
That's the key thing.
You can help yourself. Yeah.
And this is In the Public Interest. My name is Linda Johnson. Thank you very much, Dr. Simone, for being on and helping us kick off the new season this year.